Reconstructive rhinoplasty often entails the use of grafts for structural deficiencies due to malformative, traumatic, or iatrogenic causes. Although the recent literature reports favorable results for some alloplastic grafts, the major case studies document the total safety of cartilage grafts, which are recognized as easy to shape and resistant both to infection and to reabsorption. It should be borne in mind that alloplastic graft can hardly offer the flexibility characteristic of the tissues to be replaced and present a greater risk of inflammatory response. On the other hand, the major case studies indicate a negligible percentage of inflammatory response to cartilaginous grafts and a low degree of absorption. About the donor region, septal auricular or costal cartilage can be used in order of preference. However, septal cartilage is often absent or insufficient to fill all the structural gaps in the case of reconstructive rhinoplasty. On the other hand, the use of costal cartilage can prove more complex and present some discomfort of the donor region. The use of grafts of auricular cartilage, primarily concal, has won increasing favor over the last few years. The ease of excision, the absence of visible scars in the donor region, and the large amount of tissue available constitute the basic reason for this preference. The removal of a concal cartilage is carried out by means of a retroauricular approach, leaves no visible signs. The concal cartilage removed can be used to prepare grafts of different shapes and types in accordance with the reconstructive requirement. Crucial importance is linked to the use of portions of concha most similar to the nasal anatomical components to be reconstructed. For example, the Simba concha is the first choice for reconstruction of the cartilage of the nasal ala because it possesses a curved three-dimensional structure that closely resembles the element to be replaced. The thickness and particular stiffness of the cavum concha instead make it the best source for shield graft, serving to improve the definition, symmetry, and projection of the nasal tip. Both the Simba concha and the cavum concha can be used for the preparation of the alar butter graft, which are frequently required in secondary rhinoplasty for problems regarding the excessive resection of lateral and or triangular cartilages, which weakening and retraction of the lateral nasal wall. Such situations often lead to respiratory problems which collapse of the nasal valve during inspiration. In such cases, the laterally oriented convex face of the graft helps to lateralize the collapsed portion of the nasal wall. Finally, the curved shape of all the conchal cartilage makes it suitable for the correction of saddle nose deformities of various degrees. To this end, various layers of cartilage can be sutured together depending on the scale of the deformity.